I'm going to position this avian patient in right lateral recumbency. For this position, again, we place it on the plexiglass for ease of restraint and preventing from manually holding the bird. The bird's neck is gently extended dorsally and secured with masking tape. And the wings are extended cranially. The dependent wing is slightly more cranial than the other to differentiate them both, and masking tape is taped over to secure the wing to the plexiglass. The hind limbs are pulled caudally. Again, the dependent limb is pulled slightly cranially, and both are secured to the plexiglass. And the tail is again secured. The marker is placed cranial to the sternum. The X-ray beam is centered in the mid-body, halfway between the sternum and the spine, and the whole body is collimated. And again, this exposure will be the same as the ventrodorsal view for an exotic patient.